President Trump has issued a warning about Social Security and Medicare just 2 days before the announcement of the annual Social Security cost of living adjustment. Let's review the headlines together. This is from Newsweek. Social Security, Medicare are going to be gone, Donald Trump warns. And there are other headlines that are pointing to the same issue. So I want to review them together with you. This is another one from Newsweek. Social Security warned warning issued over COLA only going to get worse. So you can see there is a trend here, and it has to do with the future of your benefits. And here is another headline from CNBC. It is saying that Social Security cost of living adjustment for 2026, why some retirees wish it was more. So I'm going to talk to you about what all of that means. And then finally, let's look at this headline from Fox News that also talks about what is happening with COLA. So it says, should Social Security COLA be measured with a senior focused inflation metric? I'm going to explain what is going on, what the president's warning is about, and what you should know a day before the 2026 cost of living adjustment is going to be announced. My name is Kwame Kwade. I am a government benefits expert. For 15 years, I have been helping seniors get the retirement benefits they deserve. I create content on Social Security, Medicare, Medicaid, food stamps, and other personal finance topics that affect seniors and their retirement. If you are new to my channel, welcome. I am glad you're here. Do me a quick favor, go into the comment section and let me know your city and your state, because I like to know where you guys are watching my broadcast from. And if you've been watching my channel for a while, welcome back. I am glad you're here. We have a ton to cover, but the main point I want to start with is the president's warning. Why is President Trump issuing warning about Social Security and Medicare and saying it's going to be gone? Let's dig into it. So I'm going to share my screen again, and then we can understand specifically what the president is issuing a warning about. So here we go. So President Social Security, Medicare are going to be gone, Donald Trump warns. And we're going to read this together. I want to make sure that you can see it on your screen. So here, this happened in the White House. President Donald Trump warned on Tuesday that if the Democrats don't approve funding, there are dangers to the future of Social Security and Medicare. Trump said at a press conference that when he asked Democrats for feedback on funding bills, it means death. Let me repeat that again. Trump said at a press conference that when he asked Democrats for feedback on the funding bills, one said it means death. There's nothing about death, Trump said. There is death because they are going to lose Medicaid, they are going to lose Social Security, they are going to lose Medicare. All of those things are going to be gone because the whole country will be bankrupt and we are not going to have any kind of medical insurance. So the question is, what is the president talking about? Let me make it make sense for you. So right now, the Congress is at an impasse with the White House, and specifically Democrats have refused to back the spending bill because of what happened with the Big Beautiful Bill. Democrats are saying that the Big Beautiful Bill ripped out a lot from seniors, that in terms of health care. And so let me digress and share with you the healthcare consequences of what happened, and then we can talk about what the president is referring to. So I am going to share my screen and show you a couple of examples of what is happening with healthcare costs and why, what the president is saying and what the Democrats are saying all make sense. So first of all, if you are a senior and you are on Medicare, obviously you're experiencing tremendous price increases, and that is well documented right now. Seniors are paying about 12% next year on Medicare Part B premiums and are paying about 11.6% on deductible. I may have those numbers flipped. But the point is that you're paying at least 11% for Medicare Part B premium, deductible, and your premium. On top of that, seniors are paying on average $6,000 in out-of-pocket cost just for Medicare on average. Now, if you're a senior and you're not 65 yet and you don't qualify for Medicare, you are about to face a cliff that we've never seen before if the subsidies that were ripped out of the big, beautiful bill that were helping seniors buy health care on the open market is not put back in. And that is what this impasse is about. So let me share with you some data on the increases that are coming next year, starting January, if those subsidies are not put back. And this affects a large portion of seniors. So the president is asking Congress to fund the government just as they have proposed, and the Democrats are saying no, you need to put back what was taken out with the big beautiful bill. So let me share with you some price increases that are happening, and I'm going to share this number with you by state so that you can see that this is a serious matter. So let's start with Kentucky. Okay, here's the data from Kentucky from the Center for Budget and Policy Analysis. So if you look at this chart, let me remove this. By the way, the number you see on the screen at the bottom, if you want to stay on top of the news and get updates from me by text message, then join my text club where I send you breaking news updates and not only the news, but what is behind the news. So text the word insider to 443-293-0080 and you'll be added to my text list. It's free of charge and you will get breaking news and update and other relevant important news information that I think you should know about. So that is the number you see at the bottom of the screen. But I'm going to take that off for a second so that we can have a full picture of what's happening. So you take Kentucky, for example, and you see there are two bars in there. Right now, if somebody's making $66,000, right? A family of four making $66,000 and their healthcare cost is $2,000, which is a lot, but it's still reasonable because they are getting government subsidy to afford it. Without the government subsidy, which has been ripped out of from the big beautiful bill, their cost is going to go up to $5,300. That's more than double what they're currently paying for health insurance, and they're only making $66,000. Remember, that is before taxes. If you make $130,000, a family of four, maybe the husband is making, $60,000, the wife is making $65,000, or both are making 60, 55, 65, whatever. You make $130,000, and all of a sudden, you are paying $11,000 with the government subsidy. $130,000 anywhere in the country is not a lot of money. In today's inflation environment, it's not a lot of money. And then you're paying $11,000 of that in health insurance. Without the subsidy, they are going to pay $23,000 next year. Okay, I'm giving you the background because I'm going to show you a lot of data from other states so that you can paint the picture. Now let's talk about seniors. If you're a senior and you are making 60 years and over, both of you are making $40,000. 20,000 one person, 24,000 another person. Now you're paying $1,400 with the subsidy. Without the subsidy, a senior making $44,000, a couple, will pay $3,627 in Kentucky. Now check this out. If you're a senior citizen, both of you are working, age 60 and above, making $85,000. $85,000, which is not a lot of money anywhere in the country. $85,000. One person is making 45, one person is making 40. That is average. You are paying $7,000 right now in health insurance by buying health insurance on the market. Without the subsidy, you are going to pay $30,000. $30,000. You're just making $85,000. 30,000 of 85. Let me calculate that. And just health insurance. And like the fact that we're in a country where this is even a discussion and an expectation that somebody making 85,000, a senior citizen making 85,000, is going to pay 30,000 for health insurance when other advanced countries have, you know, universal free health insurance. But that's a whole different topic. That's debatable. I'm not going to get into the politics of it. But my point is that this is ridiculous because $30,000, okay, $30,000, actually it's 30,800. $30,800 divided by 85,000, that is almost 37%, one or more than one third of your income is going into health insurance. We haven't even talked about rent or mortgage and everything else. And you are 60 and older. How about you are at almost a retirement age and you should be able to enjoy life? They're saying no. Give us all your money in health insurance. So this is Kentucky. So I'm going to show you a few other states, and then I'm going to go back to what the president was saying so that it all makes sense. So let's go to Maine. Same story. You're looking at Maine, and this is from the Center for Budget and Policy Priorities. Let's go to the senior section. 60 and over. You're making 44,000. You're paying 1,000. Without the subsidy, you're going to pay 3,000. 3 times, triple. If you're making 85, you're paying 7,000, which is a lot already. You're going to pay 36,000. It gets even worse. So in Maine, you're paying 36,000 divided by 85,000, 42%. Guys, they're asking you to pay 42% of your income in health insurance. And this is just the premium. We're not talking about all the nickel and diamond they're going to do at the end, which is out-of-pocket deductions and maximum out-of-pocket costs and co-pays and all this nonsense that happen in addition to the premium that you're paying. This is just premium. So I'll give you a few more states. I'm going to do a whole video talking about these individually because I think it's important. But I'm going to give you a few more states so that we can see. Let's go to California. Okay. Now let me pick another state. New York. Let's pick a big state, New York. So if you're in New York, same story. I'm going back to seniors, well, this is diced in a different way. But if you're a family, you're making 132,000, you're going to pay $28,000. And if you make 82,000, because income is different in New York, you're going to pay 7,000 without the subsidy, 3,000. So without the subsidy, people's health insurance is going to more than quadruple. In certain cases, it's going to get worse, like way, way worse. So now what am I saying? And this is I have 20 different states, and I don't want to share all of that. I'm going to share that in a completely different video when I talk about what is happening with health insurance, what is happening with seniors who, not every senior is on Medicare because you have to be 65 to qualify. So there's a lot of seniors who are not on Medicare who are facing this situation. And so now we go back to what the president was talking about, which is the fact that, the Republicans want the government open and the bill passed the way it is so that we can all move on. And the Democrats are saying no. So that is what is happening. And he's saying a point of contention leading to the government shutdown is the Democrats' refusal to accept a funding bill that will cut health care provisions, which many Republicans argue fund medical care for illegal aliens. And that's just a talking point. When this is look, the Republicans are saying that the Democrats are holding the line because they want to fund health care for illegal aliens. I am not going to comment on that because that's political stuff. What I'm going to comment on is that seniors are beginning to see the premium increases that they are going to experience starting in January because it's open enrollment. A lot of states have started previewing what you're going to see. And open enrollment for everybody else starts November 1st. I know Medicare has already started, but open enrollment starts November 1st. And you're going to see, seniors are going to see, those who are not 65 yet are going to see the premium increases. So this is not about illegal aliens. And people can debate that whether illegal aliens are getting medical care or Medicare and Medicaid and all that. I'm not going to get into that because that's not my intention. That's not my purpose here. My purpose here is to highlight things that are going to affect your pocket. As a senior citizen, remember, we are saying that our focus is putting seniors first. That's my mission. And so I want to make sure that you understand what is behind the news. And so the politicians can dangle red meat and get everybody distracted about, oh, they want to fund healthcare for illegal aliens. That's not the argument. The argument is that they've ripped out subsidies that help people afford health insurance, including seniors, when they passed the big beautiful bill that gave a lot of money to the rich and removed a lot of programs, including food stamps, Medicaid, and health insurance subsidies for the poor and middle class. And now that bill, the effects of that bill is about to be realized in November, where everybody is going to go and do open enrollment and renew the healthcare, and then realize that, holy crap, my healthcare has gone from $7,000 a year, which is a lot of money already as a senior citizen, to $30,000 if you live in Kentucky, or Maine, $36,000, etc., etc. That is the debate. That is the debate. And so that's where we are. And the Republicans are saying that those cuts have to be made in order to save Social Security and Medicare for the future. Now, I would tell you that ripping health insurance away from seniors and the middle class and say that you're doing that to save Social Security and Medicare for the future is at best misleading, because there are 5 ways to save Social Security and Medicare for the long haul, for the future. If you've been watching my videos, I have shown you the 5 different options available to Congress to fix Social Security, Medicare for the future. Come 2032, the Social Security Trust Fund is going to run out of money. Excuse me. And something needs to be done. I've done videos about that, where they need to bring in more money, or they need to slow how much money is coming out of the system. That's a whole different topic. But I want to talk about COLA for a second, because I shared with you highlights about COLA in the other breaking news updates that I share with you. So let's talk about that, because COLA is tomorrow, October the 24th. And if you've been watching my channel, you know I have talked about that a lot. So let's look at the next article from Newsweek. Social Security warning issued over COLA. It's only going to get worse. What is that about? Well, the Senior Citizens League, one of my favorite and most respected senior advocacy organization, has issued a warning over the upcoming cost of living adjustment, also known as COLA, alleging that the benefit increase for seniors is only going to get worse. The organization's analysis revealed that the average senior who retired in 1999 has lost nearly $5,000 in Social Security payments due to the government using the CPIW, a price index that tracks inflation for people who work and live in cities. That is the best description of the CPI, the CPIW. It's an inflation index that tracks inflation for people who work and live in cities. Instead, the Senior Citizens League is calling for the government to calculate payment increases using CPIE, which is designed to reflect seniors' inflation specifically and tend to come in slightly higher than the CPIW. On average, the CPIE is 0.1 percent points higher than the CPIW. Why does this matter? Well, around 70 million Americans rely on Social Security each month, and the COLA was supposed to be announced on October the 15th, but because of the government shutdown, it's now going to be announced on the 24th. And expert analysis is saying that it's going to be around 2.7 or 2.8. So that's that's what the prediction is saying, but that is not enough. And here's what the CNBC article was talking about. So let me share that with you. So CNBC is saying that COLA is not enough, and a lot of seniors agree. And so Social Security cost of living adjustment for 2026, why some retirees wish it was more. Well, why do seniors wish cola was more? Because cola has not kept up with inflation over the last 15 years. Every year, cola is behind inflation. So the inflation that seniors are experiencing is higher than what the actual cost of living adjustment is. So let's read a little bit of this. So, um, I have read that experts have estimated. Let me make sure that you can see what I'm reading. Yes, you can see it. So it's saying that experts have estimated that the Social Security COLA for 2026 may be in the range of 2.7 to 2.8 based on the latest available consumer price index data. That's in line with long-term average, but for retirees and other beneficiaries who rely on their benefit payment to cover essential expenses, the size of the increase might not be enough. I wish it was more, says Catherine Bailey, 74 of Washington, D.C. So why does Catherine wish cola was more? Well, I'm going to tell you. So here it is. So Bailey, a retired oncology researcher, remembers when the 8.7 cost of living adjustment was put in place in 2023 in response to the pandemic. That approximately 135 monthly increase Bailey received then helped, but it's all used up. So the projected increase for 2026 won't do anything. Why is that? Why does she think that it didn't do anything? Because it's going to be a $54 increase. Well, in 2023, you got $135 increase in your Social Security benefits. In 2026, it's projected to be around $54 because it's going to be 2.7 or 2.8%. So let's find out why she feels this way. And I agree, but I want us to read it together so that you can understand. And here has been the COLA increases over the last 20 years or so, maybe 30. It's 1980, so it's even further. But you can see that since 1990, it's actually been relatively low. And next year, the projected one for next year, is going to be even lower. So why does she feel that COLA is not enough? This is what I want to show you right here. This right here. So what is that? Well, according to Goldman Sachs, one of the prominent investment firm, the cost of retirement has outpaced inflation, according to recent research from Goldman Sachs Asset Management. While retirees' spending increased by 3.6% on an annual rate from 2000 to 2023, the consumer price index went up 2.6% over the same time. So, essentially, what Goldman Sachs is saying is that seniors are the inflation that seniors are experiencing has been higher than the cost of living adjustment that seniors have been receiving since the year 2000, which is the same thing that the Senior Citizens League is saying, that seniors have lost $5,000 in spending power because cost of living adjustment has not matched inflation. So what does this mean? Well, the Senior Citizens League is proposing that they change the formula so that the formula will truly reflect what seniors are experiencing. But Republicans are pushing back, which is what I shared with you in the Fox News, article, because Fox is asking the question: should Social Security COLA be measured with a senior-focused inflation metric? Social Security annual COLA inflation uses the CPIW, and Senior Citizens League is proposing that they use the CPIE, with the E standing for elderly, which would track cost of living increases that specifically affect seniors. So that is the news of the day and why all of this is going on. And there are two more things I want to share with you. First, I want to talk to you about the new community that I have started that is going to help us even dig deeper into some of these topics. If you feel like there's a lot going on and it's hard for you to just keep up with all the news and updates that are happening, I have a solution. And a lot of seniors have already joined this group, and they are getting the benefits of being part of a community where I get to share a lot more with you in terms of what is happening and how it's going to affect you and your retirement. So, for years now, seniors have been asking for a community because, even though you're watching my content on YouTube, it doesn't feel like we are in a part of a community where we can talk to each other. And so, after years of researching it, I finally launched one on the school platform. And what does this mean? Well, it is a place for you to stop missing out on retirement benefits and perks that you deserve. So, my goal is to minimize your stress and help you maximize your retirement by getting the help that you deserve. So, this is an online community for seniors 55 plus. And what you get is being able to unlock every dollar discount and advantage from Social Security, Medicare, Medicaid, and more. What do you get by joining this paid community? Well, you get exclusive weekly videos on maximizing your Social Security and Medicare and more, monthly money saving tips and senior discounts, step-by-step resource guides. I'm going to talk about that. I'm going to show you all the guides that we already have in the community, live Q&A session with me and other experts and my team, and a supportive, friendly community. YouTube, that is not a community, it's a platform. This is a community where you are part of a group of seniors that are heading the same direction, that want the same thing, which is to maximize their retirement and enjoy this season of their life. So here is what it looks like to be inside the group. I host video Q&A sessions specifically for the group. You will not find these videos anywhere else but within the school community. I do Q&A. You can ask me anything on the platform, and I will do the research. If you have any specific questions, something that you want to know about, you can ask me. I'll do the research, and I'll answer you like I've done with this person who asked me a specific question, and I did the research and answered her directly. That's one of the perks that you get with this community. And then I'm always recording videos and sharing it with you, especially what's happening with COLA. I've been giving them updates on COLA and what I think about that, recording specific videos and posting it on the platform. But the biggest perk that you get right now, if you join today, is access to all my paid guides. If you go to my YouTube store, I have guides that I have created that are best in class that I'm selling. But if you're in this community, you get these guides for free. So it's all uploaded in the community. This is the platform that we're on. You can see all the guides are already in there. They're free of charge for you. And here are some of the guides that you will get instant access to right now if you join this community. The first one is 10 proven ways Social Security can make, Social Security seniors or seniors in general can make an extra $500 to $1,000. If you're retired and you want a part-time job, a part-time gig, and you're struggling to find where to look or how to look, this is the guide for you. Changes that are happening with Social Security and Medicare, I bring you all that in a guide. AI, a lot of seniors are curious about AI but don't know how to approach it. I created a guide to teach you how to improve your everyday life by using AI. Secrets to boosting your Social Security benefits. If you are receiving Social Security benefits now, you don't have to feel like that is all you can get. There are things you can do now to grow your check, to increase your check, even while you're receiving benefits. I talk about that in detail in this guide. Senior banking resources. Where can you get free checking accounts? Where are the best CD rates? Senior specific perks in banking. I have put all in one guide. The big beautiful bill. It's 2,800 pages and has a great deal of content that affects seniors, but a lot of seniors are not aware of that. I have brought all of that in a simple guide that makes sense, that you can understand how it affects you. What are the best senior discounts out there? There's a whole book that I've created of the best senior discounts, and I keep updating it and adding more. Medicare cheat sheet. And then there are templates out there, how to pay off debt, spending leak finder. Spend 15 minutes with this leak finder and you'll be able to see where all your money is going. If you're feeling like you get money and you don't know where it's going, a budget template for you to create a budget for yourself, how to save money, $520 a year by saving $10 a week, and where to find that $10 to save it I have put all of this all in here. There are almost 250 seniors have already joined this platform as I'm speaking right now, and you can see it's popping. There's a lot going on. We're having a ball because we are engaging with each other. People, it's a safe community to be a part of, where you can get your questions answered. You can interact with other seniors, and we have so much going on you want to be a part of, in addition to being able to ask me questions directly and get answers personalized to you. So if this is something you are interested in, and I think you enjoy it, go to school.com/benefits insider. I'm going to put the link in the comments and in the description to this video. The membership you pay, even for the entire year, okay, you get that in the first day you join, because even the guides that I've made available to you, it's more than what you pay in membership for an entire year. And then within those guides, there's about $2,500 in savings put all together. So there's no losing by being part of this community, because even what you pay for an entire year, you get it the first day, because you get access to all these guides. And if you go to my YouTube store, you will see all those paid guides and what the prices are, so you can add it up yourself. So I think you're going to like this. And finally, this is Medicare enrollment, and I have some reminders for you. If you are delaying your Medicare enrollment, you are heading for trouble, because there's so many changes that have happened this year that you don't want to hold on and wait till the last minute, because and the worst thing you want to do is just renew your current Medicare program. Why? Because a lot has changed. And so this open enrollment season, I am on a mission to help 100,000 seniors get right with their Medicare plan. Why? Because you've earned it. This is something you've paid into for years and decades, and so you might as well get the best out of it. But the government is not just going to give you, or put you in a Medicare plan out of generosity of their heart, because it's the best one they have for you. They want you to sort through the 24,000 Medicare plans and figure out for yourself. And that's where I come in, to point you in the right direction by educating you about Medicare, creating guides, and sharing with you free guides that can help you understand Medicare better, and then connecting you with the best resources out there. As I mentioned, there's 24,000 Medicare plans, but 90% of all seniors are in the wrong plan. Why? Because that is, in a way, very confusing, because some Medicare plans, especially Advantage plans, are specific to your local area. And so you have to be able to look at all of that and see what fits your budget, fits the provider network that you're looking for, your doctors, your hospitals, etc., and then prescription drugs, and make sure that it provides the care that you need. And so if you look at all the changes that are happening in the news, plans that are being dropped, plans that are being changed, hospitals, networks that are dropping certain Advantage plans, certain healthcare providers dropping Advantage programs altogether or leaving certain states, there is so much activity happening that if you just renew what you have, things that you think you have this year that are going to carry over to next year may not be there. And so that's why we're partnering with Chapter. I've been doing this for 15 years. I have never partnered with a Medicare advisory company because of this. A lot of them don't operate in the best interest of seniors. And the way you tell is when they are trying to push you into a specific plan rather than see what you need and what your budget is and what coverage you need and the networks you need to be in and the prescription drug coverage you need, and help you find a plan that best fits your need. That is what Chapter is about, and that is why we are partnering with them. So give them a call today, 539-205-2147. And don't delay, because there's a small window to be able to switch to a better plan. And what they're going to do is they're going to look at your current plan, and if you're in the right plan, they'll tell you, and if you're not, they'll help you switch to a better plan. These guys are the real deal. Call them. It's during the busy season, so make sure that if you want them to call you back, then go to askchapter.org/insider and fill out a form. It takes a minute. And then they'll call you back and then help you sort through what's happening with Medicare so that you can get the best plan for you and get the peace of mind that I'm talking about. And when I talk about peace of mind regarding Medicare, what I mean is that the plan that you get for 2026 is the plan that fits your budget, fits the network of providers that you need to be in, your primary care doctor, the hospitals that you need to be going to, et cetera, and then the prescription drug coverage, because there's been a lot that has happened with prescription drugs coverage that you need to be aware of. And if you live in specific states now and you're on original Medicare, now you need pre-authorization, which is a new thing that's going to happen in 2026. So you put all that together and you want to make sure that the plan that you pick for 2026 not only navigates all the changes that have happened with Medicare this year, but fits your needs. And these are the guys that are going to help you do it. These are real agents from Chapter that are ready to take your call. They are A+ rated with the Better Business Bureau. Tons of 5-star reviews that we have received from members that we have sent, over 2,000, almost 3,000 members from our viewers like you, through our recommendation, have gone and worked with Chapter and have nothing but great things to say. Besides, they can save you $1,100 a year. In this hyperinflation environment, that is a lot of money and a good savings. So give them a call today. I know they will take care of you and make sure that you get that peace of mind about Medicare that I've been talking about. So give Chapter a call today. If you like what you heard, hit the like button, hit the subscribe button, and I'm looking forward to seeing you in another video tomorrow.